Rickets. What is rickets? An inadequate mineralization of bone in children is known as rickets. In adults, it is known as osteomalacia. In children, the growth rate is disrupted. In combination of softening the bone leads to characteristic deformities. There are different causes for rickets. Among them, reduced serum 1,25-dihydroxy vitamin D is by far the most common cause of rickets. It is due to a lack of 25-dihydroxy substrate, resulting from the combination of nutritional deficiency and lack of sunlight exposure. Another form of rickets is vitamin D resistant rickets. It is a genetically determined condition that presents in childhood with rickets that is resistant to therapy with vitamin D in standard dosages. Another kind of rickets is hereditary hypophosphatemic rickets. It is an X-linked genetic disorder with dominant inheritance caused by the mutation in the PHEX or phosphate X gene, which leads to a mis-elevated fibroblast growth factor 23 levels. Clinical features of the rickets may comprise the following. The infant with rickets may present with tetany or convulsions due to hypocalcemia. Early bone changes are deformities of the skull, known as craniotabes, and thickening of the knees, ankles, and wrists from growth plate overgrowth. Enlargement of the costochondral junctions, which is rickety rosary, and lateral indentations of the chest called Harrison circus. Lower limb deformities, such as coxa vara, may develop after weight bearing, or overall growth may be stunted. The management of the rickets. The management of vitamin D deficiency rickets response involves a wide variety of doses of vitamin D. Depends on the levels of deficiency. Type 1. Vitamin D resistant rickets responds partially to very high doses of vitamin D. Calcium and phosphate supplements are necessary. Type 2. Vitamin D resistant rickets responds partially to very high doses of vitamin D. Calcium and phosphate supplements are necessary. Hereditary hypophosphatemic rickets treatment has been with phosphate supplements and calcitriol, with the aim of improving intestinal calcium and phosphate absorption. Physical therapy may be necessary to improve mobility and function. Focus on early morning sunlight exposure may be helpful. Thank you.